Welcome to 10 Steps to Create a Trauma-Informed Resilient School. I am Shaylin Soma, the Chief Clinical Officer at Star Commonwealth. I'm a social worker and a psychologist, and I have worked with at-risk children and adolescents in various settings, including schools, for the past 20 years. I am really passionate about this work. I firmly believe that all child caring professionals need to be trauma-informed, and that when they are, their work becomes more meaningful and rewarding than ever before. A recent study showed that when educators adopt trauma-informed attitudes, their job-related stress levels actually decrease. And who wouldn't want a reduction in their job-related stress? You can find the article that discusses this study more in depth in the resources section of this introduction section. This course will teach you how to create a trauma-informed school and classroom by following 10 steps we have learned matter most to transforming your mindset and implementing trauma-informed practices. Each section of the course will present each step. Following each step, there will be some recommended videos, resources, or activity suggestions to help support the content presented within that step. Please take advantage of these since they will really help you to understand and implement the content of each step. The course will begin with a focus on resilience. You will learn how to nurture and foster resilience as you explore student strengths and assess whether or not their universal needs are being met with regular resilience building experiences. Then I will discuss how trauma and stress impact children and their school experience. We will talk about how and why trauma and stress result in difficulties with learning, managing emotions and behavior, and unfortunately, in many situations, it results in students receiving diagnoses like ODD and ADHD when trauma goes unrecognized. The next section, steps 3 through 6, will cover several proactive strategies that can actually be used school-wide, such as fostering connections, prioritizing social and emotional skills, establishing a sense of safety, and promoting play. These strategies aim to support students who have or who continue to experience stress and trauma, while providing protective experiences for all of your students to help them build their resilience. During this section, you will walk away with several specific and very practical strategies to help you implement each of the steps. For students who need the most support, in step 7, we will explore how a student's private logic, how they view themselves and others, affects their behavior, relationships, and academic achievement. You will learn how to conduct a private logic assessment, a universal need assessment, and create a support plan that is both strength-based and resilience-focused. This support plan will help support students in the school setting. Strategies to collaborate with student families and your communities will also be introduced in this course because we know that you can't do it alone. Students, especially those who experience trauma, require as much wraparound support as possible. We will also talk about how to best support yourself and your staff when working with students who demand so much of our energy and attention. This course will end with some examples of how to collect and utilize outcome data as you implement trauma-informed schools practices. And lastly, I will share some of the outcomes of our own Resilient Schools project. I know that the field of education is more challenging than ever. My hope is that this course will give you some new ideas and practical strategies and tools to use in your schools and classrooms to make your work with children both rewarding and effective. Keep in mind that some tools presented will work better for you than others. You may end up picking and choosing which parts of this course are best for you to implement, depending upon your setting and the specific student population you work with. I do understand that there isn't one course that can fix all of the struggles that you face as educators. Funding, class sizes, school violence, standardized testing, there's so much. But I am hopeful this course will help you despite these big challenges. So let's get started. The National Center for Traumatic Stress Network is now asking schools and educators to play a key role in addressing the needs of traumatized and stressed children. Why? The prevalence of stressed and traumatized students is higher than ever. And coupled with that, there is a significant shortage of mental health practitioners to meet the needs of these students. Our theory of change at STAR is when trauma-informed and resilience-focused adults work within trauma-informed and resilience-focused systems, the well-being and success of children will increase. This course will teach you what you need to know and provide you with strategies to use in your classrooms. We will cover both the why and the how. With the understanding of resilience and trauma and the tools to use to support your students, you will have just what you need to become a trauma-informed educator. This, we believe, will help bridge that gap between the significant needs of students today and the number of caring adults who know how to support them. Let's take a look at some of the most recent statistics about children and trauma. These statistics are from the 2020 National Survey of Children's Health, conducted by the Data Research Center on Child and Adolescent Health. Over half of the nation's children have experienced at least one or more types of childhood trauma. We know that about 1/3 of students have been bullied. 60% of students 17 years old or younger have been exposed to crime, violence, or abuse. And 30% of students in urban schools have witnessed a stabbing or shooting. There has been a 45% increase in self-harm and suicidality from 2019 through 2021. Just think about the fact that 12 million children are living in poverty. We also know that now there is an epidemic of childhood grief due to COVID-related deaths. And more children than ever are living with a parent or a caregiver struggling with depression and anxiety. It is also so important for us to mention that children of color are at an even higher risk for exposure to trauma because of racial and generational trauma that is passed down to them. They also experience a lot more barriers to accessing care, as well as social determinants that complicate their mental health outcomes and trajectory for healing. We will talk more about this as we move through the course content. But these statistics, coupled with the lack of access to mental health practitioners for all children in need, has actually led to a national emergency being declared. In fact, in 2021, the American Academy of Pediatrics, along with the American Association of Child and Adolescent Psychiatrists and the Children's Hospital Association, declared a national emergency in child and adolescent mental health. So back to that call to action. You guessed it, right? The National Center for Traumatic Stress Network is calling on us, calling on educators, on schools to become trauma-informed, because school is the best place to positively impact children outside of their homes. Trauma-informed resilient schools have 10 things in common. We are calling them the 10 steps to create a trauma-informed resilient school, and are using these 10 steps in this course sort of as a map for implementation and success. These are the 10 steps. Focus on resilience, understand trauma as an experience, foster connections, prioritize social and emotional skill development, establish safety, promote play, believe the link between private logic and behavior, collaborate with families and with communities, support and invest in staff, and lastly, collect and utilize outcome data. It's really important to understand that it's hard to identify what the most important step is. As you will see throughout the course, the steps overlap and they are not linear. However, with each small implementation of the steps and the strategies within the steps, the benefits are significant. So just be patient with that process. So what does being trauma-informed and resilience-focused really mean? What I want you to take away from this course more than anything is that being trauma-informed and resilience-focused is a mindset, a set of core values and beliefs about children. It's really a new way of viewing and interacting with our students, with our colleagues, and even with ourselves. It recognizes that students come to school with their own set of experiences and an assortment of beliefs. It means that harmony and respect is the right of all students. It nurtures equality and inclusion in the classroom because being trauma-informed means that you understand that students who are marginalized and excluded as members of society because of their race, abilities, or sexual orientation are very vulnerable to stigma, to violence, and discrimination due to their real or perceived identities. And this is trauma. Being trauma-informed means that you have a belief in the possibility of well-being by restoring and nurturing resilience, despite the adversity that students have experienced. It means that you understand that experiences have impacted the way that a student behaves, the way that they interact with others. It means you are always curious about what can be done to support a student. What are the new opportunities and experiences that a student needs in order to succeed? It means that you believe that there is no such thing as a bad child, because badness is not a normal condition, but is the result of misdirected energy and unmet needs. And lastly, it means that you view children as sacred beings. So this is the mindset. These are the core values and beliefs that will guide us through the implementation of each step. Now we're ready to move into the steps. 10 steps to create a trauma-informed, resilient school.